Hello, hello, hello. If you stumbled across this video, you are in the right place because today we are going to be talking about 25 different nursing positions that you may not know about. My name is Portia Blackman and I am a student RN, and I wanted to make this video just to kind of shed light on the different career positions that you can have as a nurse. So let's jump right in. So first, I want to talk about how there are 31% of RNs that works in the general medical and surgical hospitals. Yeah. And so after I've done my research, it amazed me at the different positions that nurses actually have. And I would have never known it had I not done research. Because, when we think of nurses, we think of just working in the hospital sector or working in nursing homes and things like that. But no, there are so many. And I've only found 25, but there could be more. 24% work in specialty hospitals. 16% works in psychiatric hospitals and substance abuse hospitals. 16% also works in outpatient care centers. 11% works in home health care centers, and 9% works in nursing facilities, such as like nursing homes and assisted living facilities and things like that. And 7% works in physicians' offices. And so healthcare is growing. It is constantly growing. Nursing is a high demand. It is a high demand job, and it's the fastest growing industry. Healthcare is the fastest growing industry that is out there in the United States. And so if you are not from the United States, coming over here to work in healthcare is a great opportunity because there is so much room for you to grow. So much more room. There's a lot of opportunities, and I don't want people to limit themselves on the things that they can do. So if you are considering nursing, don't limit yourself on what you can and you can't do, because it's just so many different opportunities. Between 2019 and 2029, it's an estimated growth that 222,000 nursing jobs will become available for aspiring RNs, and which will bring the total to 3,300,000 RNs in the United States. That is a lot of nurses. So the demand is consistently high, and it is nearly a need in all sectors. And we're going to go over these different sectors here in a minute. But just know that if you are coming into healthcare, if you're coming into the nursing field, there is so much room for you. And it is also not just that, but it's very lucrative as well. Very lucrative. Maybe I'll do a separate video on the different nursing salaries. Yeah, I'll do that. I think that'd be really good. So let's go over the different types of nurses. So if you are looking to pursue a career in nursing, of course, rest assured that job opportunities will be abundant in a couple of years. Abundant. Whether you are earning an associate's degree, whether you are earning a bachelor's degree, or whether you even going for your master's, whatever you're going for, or even your doctorate, there's room. There's so much room. Now let's talk about the first type of nurse. We have the advanced practice registered nurse, which is also titled as APRN. APRNs, they treat, they diagnose patients in need, and they may even prescribe medications. There are many type of APRNs, and many of them also are now able to practice by themselves. So meaning that if you do choose to go this route, depending on the state that you live in, you will have the opportunity to open your own clinic and practice by yourself. Some states require you to practice under a overseeing physician, and some states do not. So APRNs require at least a master's degree in nursing, which is a MSN, And the second type of nurse is a critical care nurse. Critical care nurses are registered nurses that work in intensive care units. They provide a complex care to those with critical illnesses and serious injuries that require rigorous care. And so with that, many critical care nursing positions, they require you to have a BSN or a bachelor's degree. And this is a brief overview. So as I'm going down the line for each nursing position, it's just a brief overview. As you do your research, you will begin to dig and find more information regarding each one of these roles and positions. So this is just an overview. It's not limited to anything. So I highly suggest that whatever career choice that you do choose, that you really do your research and find out all of the different things that you can and what will be available to you. So the third one is a family nurse practitioner. A family nurse practitioner, commonly called FNPs, act as primarily as care providers for patients. So you will be pretty much practicing in your own clinic, overseeing patients and their care. You'll be able to assess patients and coordinate treatment plans, prescribe medications, and also you will have an advanced scope of work as well. So becoming a FNP requires you to have a master's degree. And the fourth one that I thought was really interesting, because I didn't even know that this type of nursing position even existed, but there is a such thing called a forensic nurse. And so if you're into forensics, if you're into things like that, this would definitely be something that you might be interested in. A forensic nurse evaluates patients and victims of crimes who may have been subject to physical violence. And they work alongside of the courthouse, court officials, police officers, things like that. They assess biological evidence for criminal cases to present in court. Forensic nurses may practice with an associate's or a bachelor's degree. That's pretty good. So the fifth one is a geriatrics nurse. So a geriatric nurse are RNs that care for elderly patients. Typically, these patients are very ill due to their age, of course, and very dependent on others to function in life. So they are very dependent on others to function and to live. And so becoming a geriatric nurse will allow you to work in patients' homes, nursing homes, and hospitals. And the sixth one I thought was very interesting is a holistic nurse. So holistic nurses integrate medical care with spirituality and or other natural methods of care. They practice organic remedies and emphasize the wholesome approach to healing. It's pretty interesting. And then the seventh one, we have a home health nurse. Home health nurses typically are registered nurses that work directly in patients' homes, and they take care of patients that are elderly, that are disabled, chronically or terminally ill. But in any case, the patients here that they are caring for, they cannot live independently or without the care of a nurse. So the eighth one is a labor and delivery nurse. Now, I'm very familiar with labor and delivery nurses because I actually had 6 babies. So I kind of got an idea of their job role just by being in the hospital and them caring for me. But labor and delivery nurses, this is the type of nurse that typically works in hospitals, OBGYN departments, and some may even work in private practices, OBGYN private practices as well. And labor and delivery nurses also assist mothers through birth. They provide supportive care for newborn babies and help in the postnatal treatment of the mother and child. I remember when I was delivering my babies, I had some of the best nurses, some of the best labor and delivery nurses that was like, I knew that like you was called to be a nurse because of the way that they made me feel, the way that they took care of me and my baby. I've had some of the best nurses to care for me in labor and delivery department. And I know that is not an easy job. It cannot be, it may not be easy caring for a pregnant mother who is going through labor and delivery and having a baby. I know that it is a high, intense, and stressful job, but it's nothing that can be done. All right, so number 9, we got the managed care nurse. Managed care nurses, they are RNs that work with patients who require long-term care. These patients have chronic or terminal conditions, and they require specialized care for the rest of their lives. So many managed care nurses also work for insurance companies as well. And they help pretty much do treatment plans, plan of care, and things like that for insurance members. Number 10, we have military nurse. So military nurses, they are always needed in the military to care for ill and wounded soldiers. And of course, other personnel. And so to become a military nurse, it will require you to have a BSN degree. And then number 11, we have neonatal nurse. So much like their title entails, neonatal nurses work for the neonatal intensive care unit. So it is primarily catered to taking care of premature babies who need continuous support and care. So that's a neonatal nurse. Number 12 is a nurse care manager. And so nurse care managers, they assess treatment plans and they facilitate services to meet an individual health needs. So this may include finding affordable and accessible medical resources for the patient and ensuring they are set up to receive high quality care. And it typically requires them to have a BSN degree for this particular position. And then we have number 13, which is a nurse consultant. The nurse consultant's main role is to evaluate patients' care. They may do this for a hospital facility. They assess the overall delivery services, or they assess symptoms, and they make recommendations on the treatment. Number 14, oncology nurse. Oncology nurses work directly with cancer patients. They work with a team of doctors to care for the patients undergoing intensive care, undergoing really intensive cancer treatments, and the ones that are battling cancer or ones that are developing a risk for cancer. Number 15 is pediatric nurses. See, I didn't know it was this many positions. But hey, this is awesome because, like I said, you will not have any limitations or should have any issues with finding a job. It should be something in these positions that may pique your interest coming into this field. Pediatric nurse, number 15. So these types of nurses, they work with babies. They work with children. They work with teens from ages from 0 to 19, depending on the facility or the company. They work primary, and they work to help them to prevent, certain illnesses and things like preventative care and things like that. Pediatric nurses often work in hospitals, outpatient care centers, schools, and private practices alongside a pediatrician. So 16, physician office nurse. This type of nurse works in private practices of a physician, commonly known as a doctor's office. So they work with a team of nurses and medical assistants, and of course, as well as the physician. And then we have number 17, which is a prison nurse. Yes, prison nurse. I know my mom, she was a prison nurse, and she worked in the prison for a while. And it was very interesting. Some of the stories she used to come home and tell us. So you have the prison nurse, which provide, of course, preventative and routine care for those in the criminal justice system. And they also help prisoners manage existing conditions, or they care for inmates who fall sick or injured in any way. Number 18, we have the psychiatric mental health nurse practitioner. And this type of nurse, they assess and treat patients with psychiatric and mental health disorders. These nurse practitioners are a type of RN, APRN, that specializes in mental health care, and they require a MSN degree, which is a master's degree. Then we have number 19, public health nurse. Public health nurses work with communities and populations to improve medical initiatives and educate others on proper care. They may do research on different diseases within the population community, administer tests to prevent illnesses in communities, or create programs to ensure the public receives proper health care and the proper education that they need. So this actually requires a bachelor's degree. Number 20, we are almost there. We got 5 more. So number 20, research analysis. So a research analysis nurse, they primarily do research. They're like scientists who work on medical studies and industry research, helping to pave the way for the future of healthcare. And most research nurses, they have a PhD and advanced nursing degree, or an advanced nursing degree. 21, school nurse. So how many got kids? So school nurses, many of our schools, mostly all of our schools have school nurses if you're in the United States. So school nurses, they work directly with school-age children in educational institutions, and it's considered one of the least stressful nursing careers, and due to regular school hours and holiday time. So you're pretty much working a full 8-hour shift, and you're coming home. You're off when the school is closed. You're off during holidays and things like that. So because you're pretty much going based off of the school calendar. Number 22, surgical RN. So surgical RNs, their main role is to assist surgeons during procedures, and also to care for patients before or after surgery. 23, trauma nurse. Trauma nurses are registered nurses who work in fast-paced environments to care for patients. So trauma nurses could be someone that works in the ER, someone that works in the ICU. So those are trauma nurses, and they are typically, they like for you to have a associate's or a bachelor's degree to work as a trauma nurse. Travel nurse, number 24. So travel nurses, they benefit from the flexibility of traveling across the nation, and also working in different facilities. They work in hospitals. They work in anywhere pretty much where they're short of staff. Nursing facilities, nursing home facilities, assisted living facilities. So pretty much anywhere that there is a shortage of staff. And number 25, and to be a travel nurse, that only requires you to have your ADN degree, which is your associate's degree, or BSN. Number 25, which is the last nursing position. It is a women's health nurse. So women health nurses, they specialize in OBGYN, reproductive health, infertility, mammography, and pretty much the overall general women's health. And typically these nurses can be found in OBGYN private practices as well as OBGYN care units. So that concludes all of our nursing careers and positions. So hopefully that really kind of helped you to kind of get an understanding of what can I do as a nurse? What do I want to do as a nurse? What interests me as a nurse? What would I find the most pleasure doing? Because whatever you do, you want to enjoy it. You want to have a pleasure doing it. You want it to be fulfilling. You don't want to be doing anything that you take no interest in, that you are just, that you don't like. It's not going to be a good career for you. And it's just an easy way for you to get out of the career because you're doing something you don't like. So if you find a position that you are really interested in, it will be more easier to stay there versus getting out completely and doing something else because you are working in a position that you take no interest in. Many nurses also, and I just remember this one, they specialize in heart health, so the cardiac unit, or working with a cardiologist and things like that. So there we have it. So I hope this was a really help to you, and let me know in the comments if you guys, if this helped you or not. I think that concludes everything. Looking at my notes here to see, and I believe we concluded everything. So I hope this was a help to you, and like, comment, subscribe, do all those things everybody else tell you to do, and I will see you on the next video.